All right. Thank you so much for everyone who's coming today. It's going just to be a short session. I'm just going to share with you guys some more of the resources that I think is really benefiting for this point at the moment. I know that you guys have been study and know the content already. So mostly now is the time to practice the questions. So we probably go over like 10 or 20 of this question in this Quizlet today, but this is the Quizlet that a lot of my friends during my semester, and also I personally used this Quizlet already when I was studying from the message one, and it helps us a lot in the exam. Because we are only message one, this Quizlet, sometimes they ask questions related to message two as well. So sometimes if the question is too hard and you guys feel like you guys don't know anything about it, that's completely normal, okay? Because usually in other university or nursing program, they don't break the master's course into two portions. They only have a whole master's course as one, not message one and message two. For this reason, that's why this is more like a combination of message one and message two. But it's a really helpful Quizlet, and I also have some more, but I will go ahead and input it down in the description box and also put it in the Facebook group for you guys to practice on your own time. Just go over these questions, trying to answer by yourself first, and then look at the rationales and look at the answer choices and know the reason why. I'm pretty sure if you guys are able to do all of these questions on here, you have a really high chance of getting more than a 900 on the HESI. That's pretty much what I study. Mostly I studied the Quizlet, and I hit really hard on the endocrine when I was studying for my HESI message one. And bring up the endocrine. Endocrine is a really important chapter for message one HESI. So I hope you guys know endocrine in and out, especially know Cushing and Addison disease, and also know the hyperthyroidism and hypothyroidism, know the medication that associated with it, and know the big thing about it. Okay. And there's one question that I always remember until this point, that is hypocalcium sign. So that will be a Shofsteg and Trozo sign, and that is usually occur because of the removal of the parathyroid gland or the removal of the thyroid gland. So a patient who post-op parathyroid gland will always be at risk for hypoglycemia, and the nurse have to always monitor for Jovstek and Trozo signs. So please remember that, okay? All right, with that being said, this is the first Quizlet that I found. It is really useful. It's have about 201 flashcards. So in your own time, please go over this. So here today, we will be using this Quizlet and answer the questions from here. We'll do about 10, 20 questions, and then I can let you guys go and you guys can practice on your own. I'll post it again in the description box. With that being said, let's go ahead and do the first question together. The nurse assess a patient with shortness of breath for evidence of long-standing hypoxemia by inspecting. All right, I'll give you guys 1 minute and then all right, we have 1C and 1D. So let's see. So first is we read the question is assess the patient with shortness of breath. Okay, so we know this is a airway or breathing issues for evidence of long-standing. What does long-standing means? Long-standing mean chronic, a long time, right? And hypoxemia is basically a lack of oxygen. So how would the nurse inspecting and know that this patient has a long chronic history of low oxygen? This would be the fingernail and its base. So let's click here for the rationales. So the fingernails and its base clubbing. So clubbing is another sign that we have to know. For example, for especially in patients who have COPD, what are the characteristics of COPD? Barrel chest, clubbing of the nails, and the finger, the base is very dark, it's very bluish. Those are signs of long-standing chronic hypoxemia. Patients who are COPD's patients are chronic hypoxemia, and the angle between the base of the nail and the fingernails can go up to 180 degrees or more. That means that the finger is clubbing. That is another sign of chronic low oxygen. And so that fingernail would be something that we inspect for someone who have a history of low oxygen, okay? And also barrel chest and tripod positions are also another signs of someone who might have COPD. Next questions. The nurse is caring for a patient with COPD and pneumonia who has an order for arterial blood gas to be drawn. Which of the following is the minimum length time the nurse should plan to hold the pressure on the puncture site? Any ideas, you guys? Give me your best educated guess. Awesome. So we have B, 5 minutes. Let's see if it's correct. Correct. So 5 minutes is the correct amount of time that you use to put the pressure on a site after drawing the arterial blood gas. So this is either you know or you don't. But usually 5 minutes is like the standard time. Like when you withdraw the IV from the patient, it's also we have to put the gauze and pressure over the IV site after the removal of the catheter for about 5 minutes as well. The only difference is if the patient have a cardiac arrest and they go to the cath lab, and the patient is having a procedure called through the femoral, the cardiac catheter go through the femoral. Post after the procedure, then we have to put the sandbag on the patient femoral site for at least 3 hours. So that's the only time that we have pressure on the site for over 3 hours. But usually with normal like small procedure like withdrawing blood or withdrawing the IV, 5 minutes putting the pressure over the site is enough. So please remember this, 5 minutes, okay? Next question, the nurse noticed clear nasal drainage in a patient newly admitted with facial trauma, including a nasal fracture. The nurse should. I really like these questions. All right, we have A and D. So let's read the questions again. So clear nasal drainage in a patient newly admitted with facial trauma. So facial trauma is the trauma directly to the face. So anyone who have a facial trauma is at risk for brain injury, for obstruction of airway, and like breathing, airway, and brain injury concern. And they also, the question even mentioned about nasal fracture. So and there's a clear drainage. So whenever there's a clear drainage that coming out the nose or coming out the ear after a traumatic injury to the head, or after a any procedure that they related to the facial area, for example, the transsphenoidal procedure where they remove part or the whole pituitary gland because of the excessive release of growth hormone, those procedures put the patient at risk for the central, the CSF, the CSF leakage. So that's why the clear nasal drainage, if it's clear and it's coming out the nose or the ear after those aforementioned diseases or problem, then we have to test the drainage for presence of glucose. So A is correct answer. Clear nasal drainage suggests leakage of the cerebral spinal fluid, CSF. The drainage should be tested for the presence of glucose, which will indicate the presence of glucose. So when we see the drainage, the clear drainage, we test for the glucose. How do we know it's the glucose? We put the gauze, clear gauze, clean gauze on the patient ear or the nose, wherever the drainage is, and then after a while, the fluid in the drainage crystallize, or it form a halo sign in the if it's blood, it will form a halo sign, and then at that time we'll know that okay, it contains glucose in it, and this is CSF fluid. It's just not regular fluid. So we have to report to the doctor immediately after we notice that is CSF leakage. Okay, but the first thing we have to do, the priority thing we have to do is to test the fluid for glucose first before we can talk to the doctor. Next question. When caring for a patient who is 3 hours post-op laryngectomy, the nurse's highest priority assessment would be? All right, we have A. So 3 hours post-op laryngectomy. So obviously laryngeal is the area related to the throat and also the airway of the patients. So that's why we can immediately tell that it's airway patency would be something that highest priority for the nurse to assess at this moment. Airway patency. So remember ABC, airway breathing circulation with prioritization. Airway patency is always the highest priority and is essential for a patient undergoing surgery surrounding the upper respiratory system. What is the upper respiratory system? It's including the trachea, the oropharyngeal, the nose. So those are the upper respiratory system. Let's move on. When initially teaching a patient with supraglottic swallow following a radical neck dissection, which of the following food would the nurse begin? This is a complicated question, so just give me your best educated guess. All right, we have some B, so let's see what's the correct answer is. So the correct answer is A, cola. Cola is Coke. The reason why they do this is because during a supraglottic swallow, it's helpful for the patient to consume carbonated beverages because the effervescence provide clues about the liquid position. Thin watery fluid should be avoided because they are difficult to swallow and increase risk for aspiration. Non-pourable puree food like applesauce would decrease the risk of aspiration, but carbonated beverages are better choices to start with. Okay. Next, The nurse is caring for a patient admitted to the hospital with pneumonia. Upon assessment, the nurse notes a temperature of 100.1, 101.4, a productive cough, a yellow sputum, and a respiratory rate of 20. Which of the following nursing diagnosis is the most appropriate based upon this assessment? All right, we have A and we have D. Okay, so let's read the question a little bit deeper. So we see that upon the assessment, the nurse notes a temperature of over 100.4, meaning that they are having a fever for sure. A productive cough with yellow sputum. So when they mention about productive cough, that means that when the patient cough, there are drainage, there are sputum, there are stuff coming out when they cough. So that means that they're able to clear their lungs by themselves. So immediately we can take away C and D because they have a productive cough with yellow sputum. I haven't seen the answer for this one, you guys. So this is what I think. So a productive cough with yellow sputum and a respiratory of 20, that means that the patient is able to clear the secretion. So my best guess is number A as well, because the question did not mention anything about chilling. So B would be incorrect. And C and D, we immediately remove it already because the question say productive cough. So they have an effective airway clearance. Okay, so let's see what's the correct answer is. Yes, the correct answer is A, hyperthermia related to infectious illness, because the patient is having 101.4, that's more than the fever rate already. And also they have yellow sputum, yellow and green, and odor, malodor are the three indicative of infections, right? So the patient has a spike in temp, they have a diagnosis of pneumonia. Pneumonia is basically infections of the lung. The logical nursing diagnosis is hyperthermia related to infectious illnesses. There's no evidence of chill, and her breathing pattern is within normal limit, which is 20 breaths per minute. And there's no evidence of ineffective airway clearance from the information given because the patient is expectorating sputum. All right. Good guess, and thank you everyone for participating so far. Okay, let's move on. Which of the following physical assessment findings in a patient with pneumonia best supports the nursing diagnosis of ineffective airway clearance? All right, I have D, so let's see what's the correct answer is. Yes, the correct answer is D, basilar crackles. The presence of adventitious breath sounds indicate that there is an accumulation of secretion in the lower airways that will be consistent with a nursing diagnosis of ineffective airway clearance because the patient is retaining secretion. So if the patient having crackles, that means that there are fluid inside the lungs, right? So whenever you guys see the crackles, immediately things fluid inside the lungs. And this question is talking about ineffective airway clearance. What does ineffective airway clearance means? Unable to remove the secretion inside the lungs. So having crackles, having fluid in the lungs definitely fit the questions. Okay, so let's look at other choices. Presence of greenish sputum. What does that indicate? That indicates that the patient having an infections. And also because there's a presence of greenish sputum, that means that the patient is not having an infective airway clearance. They just have an infection. They're able to remove their secretion, able to expectorate it. That's why it's present. B, respiration rate of 28. What does that indicate? This indicates hyperventilating. And what does hyperventilating indicate? Respiratory alkalosis, meaning that low carbon dioxide level and high pH level, right? So respiratory at 28 is hyperventilating and it is respiratory alkalosis. And what do? We put the patient with a, give the patient a bag and give the patient a chance to breathe in and out of the bag, okay? Number A is oxygen saturation of 85%. So this is hypoxemia. So this is not about ineffective airway clearance. This is about probably circulation or also or things that related to the oxygen level in the body. Or this patient may be a COPD patient. The most correct one is basilar crackle because crackle is fluid in the lungs. All right, good job so far, you guys. Next question, which of the following clinical manifestation would the nurse expect to find during assessment of a patient admitted with pneumococcal pneumonia? All right, clinical manifestation. All right, we have C, so let's see what the correct answer is. So yes, the correct answer is C, increase vocal phrenitis on palpitation. Good job. A typical physical examination finding on a patient with pneumonia is increase in vocal phrenitis on palpitations. Other signs of pulmonary consolidation include dullness to percussions, bronchial breath sounds, and crackle in the affected area. Okay, let's come back to the question slightly. So when we see hyperresonant on percussions, whenever we hear resonant, that usually means that that area is clear. Dullness, that means that it's consolidated and it's filled with like stuff in it. So that's why it's dulled when we percuss the chest. But resonant is indicate that it's clear. All right. So for this one, it's just another, you know, you don't know, you don't know. So increased vocal phrenitis on palpitation is something that associated with pneumococcal pneumonia, and we just have to learn it. Okay, next questions. Which of the following nursing interventions is of the highest priority in helping the patient expectorate thick secretion related to pneumonia? All right, we have B, increased fluid intake to 3 liters a day if tolerated. Let's see. Yes, so in order to helping someone who can expectorate thick secretion, we can increase the fluid intake to 3 liters a day if they are tolerated or if they are permitted. Although several interventions may help the patient expectorate mucus, the highest priority should be on increasing the fluid intake, which will liquefy the secretion so that the patient can expectorate them more easily. Humidify the oxygen is also helpful, but it's not the primary interventions. Teaching the patient to splint the affected area may also be helpful, but does not really require the secretion so that they can be removed. So that make that, so this is just, I guess we just have to learn it. Hydration, the more fluid we drink for someone who are bedbound, who have a history of secretion production like pneumonia, this patient, we just have to promote hydration for this patient by increasing the fluid intake, okay? And cough suppression, obviously, no. We want them to cough. We want them to cough, they'll expect the secretion out. So that's why cough suppression is not a correct answer. Splinting the affected area when they cough, usually related to someone who have an abdominal injury or have an abdominal surgery. That's when we teach the patient to splint when they cough so that the suture is intact and not being dehisced or eviscerated. Humidify oxygen is a good thing, but it's not as direct in treating the thick secretion as good as the increasing the fluid intake. Next questions. During this chart teaching, a 65 years old patient with emphysema and pneumonia, which of the following vaccine should a nurse recommend the patient to receive? All right, we have C, pneumococcal. Awesome, you guys. Pneumococcal is a vaccine that is really important for patients with history of heart or lung disease, recovering from severe illness, age 65 or older, or living in a long-term care facility. So again, we just have to know this. Pneumococcal is given to someone who are usually elderly or older adult. When we talk about H influenza, which is the flu shot, it's usually given to all ages. So that's why if the question is talking about specific population, then we have to know that in our mind and recommend the most as a related one, which is pneumococcal one. But good job. So really good job, you guys. Okay, next questions. The nurse evaluate that the teaching for a patient hospitalized with pneumonia has been most effective when the patient state which of the following measure to prevent a relapse? All right, we have D, so let's read what the rationale say. So D is the correct answer. So deep breathing and coughing exercise for at least 6 weeks is the most effective evaluation for the nurse to know that the patient is following measure to prevent relapse of pneumonia. So let's read the rationale. I should continue. It is important for the patient to continue with coughing and deep breathing exercise for 6 to 8 weeks until all of the infection has cleared from the lungs. A patient should seek medical treatment for upper respiratory infection that persists for more than 7 days. Increased fluid intake, not caloric intake, is required to liquefy the secretion. Home oxygen is not a requirement unless the patient is oxygenation saturation is below the normal. Okay, so yeah, immediate medical treatment for upper respiratory infection, that just doesn't really make sense, you guys, right? Because it's just an upper respiratory infection and this patient does not have any immunocompromised issues like AIDS or HIV or something like that. or they are cancer patients. So that's why we can immediately remove that, because upper respiratory infection can be treated at home with over-the-counter medication or being treated with rest and water, right? So I must use home therapy for 3 months. The question doesn't talk and say anything about severe COPD that related to hypoxemia. So that's why it's not a correct answer. Increased caloric intake, so it's not related to the questions as well. So good job for finding out the answer choice. After admitting the patient to the medical unit with diagnosis of pneumonia, the nurse will verify that which of the following physician orders have been completed before administering a dose of cefotetan for the patient. I don't even know what that drug is. Cefotetan is a antibiotic, you guys. All right, we have D, so sputum and sensitivity. So let's see, correct. So after admitting the patient to the medical unit with diagnosis of pneumonia, the nurse will verify that which of the following physician order have been completed before administering a dose of antibiotic to the patients. So knowing that this medication is antibiotic, we immediately think about sputum culture and sensitivity, because when do we give antibiotic? We give it after we obtain the sputum culture and sensitivity, right? So first of all, always have to do the sputum culture first, and then we give them a broad spectrum antibiotic. And after we give them the broad spectrum antibiotic, we wait for the result from the culture. And after we have the result from the culture, then we can give them a specific antibiotic that treat the targeted bacteria that found in the culture. Good job, you guys. Okay, next questions. Which of the following nursing intervention is the most appropriate to enhance oxygenation in the patient with unilateral malignant lung disease? All right, we have D, so let's see. Correct. Position the patient with good lung down is the therapeutic positioning. Identify the best position for the patient, assuring stable oxygenation status. Research indicating that positioning the patient with the unaffected lung, which is the good lung dependent, best promote oxygenation in patient with unilateral lung disease. For bilateral lung disease, the right lung down has best ventilation and perfusion, increasing fluid intake and performing post-surgenic with facilitate airway clearance, but positioning is the most appropriate to enhance the oxygenation. Okay, let's read the questions again. So this is unilateral malignant lung disease, unilateral meaning one-sided, right? One. So because it's only a one side affected lung, so that's why we recommend that these patients lay on their side with the good lung down, because the secretion from the bad lung can go with gravity into the middle of the patient, into the bronchial and go, so that because it's in the bronchial, so that the patient will have the urge to spit out or expectorate the secretion. So that's why we recommend that this patient lay on their good side, so that the bad side, all the secretion can go down to the bronchi, and then the patient can expectorate this out. So that's why D is the correct answer. And the most effective positioning is really important, okay? With that being said, if someone who is currently experiencing shortness of breath, the best position for them is semi-flower, right? We want them to sit up and breathe, or sit them up flower or semi-flower, depend on the question. But if to sit them up is the best answer choice for someone who currently experiences shortness of breath. Okay, next question. We do 14 and 15, and then we can call it a day, and then you guys can practice this more at home. Okay. A 71-year-old patient is admitted with acute respiratory distress related to core pulmonale. Which of the following nursing intervention is most appropriate during admission for these patients? All right, I think we have D, so let's see. So C is the correct answer. Perform a physical assessment of the respiratory system and ask specific question related to this episode of respiratory distress. Because the patient is having respiratory difficulty, the nurse should ask specific question about this episode and perform physical assessment on this system. For the history, taking and physical examination of other body system can proceed once the patient acute respiratory distress is being managed. So basically the question is asking about this patient is having an issues with the respiratory problem. So which intervention would be the best during the first time that the nurse assess this patient during admissions? So we don't complete a full physical examination to determine the effect of respiratory distress on other body function at that moment. What we first do is we have to perform the physical assessment of the targeted complaint area that the patient is chief complaining about. For example, the patient is admitting because they have severe abdominal distress or severe abdominal pain, and we have to specifically assess and asking question related to that system or that organ or that area of the patient. So likewise in this answer choices, we have to targeting the respiratory system because the question is about respiratory. And then we can go on to the other assessment. But at the moment, the best one is targeting the place that the patient is complaining about. And we never delay. So A is incorrect and comprehensive, meaning everything. So B is also incorrect. All right, last questions. When planning appropriate nursing intervention for a patient with metastatic lung cancer and a 60-year back history of cigarette smoking, the nurse recognized that the smoking has most likely decreased the patient underlying respiratory defense because of impairment of which of the following? All right, we have A and B. So let's see what's the correct answer choice is. So the correct answer choice is actually D. Mucociliary clearance. Smoking decreases ciliary action in the tracheobronchial tree, resulting in impaired clearance of the respiratory secretion, chronic cough, and frequent respiratory infections. So these are one of the biggest side effects of the smoking. It causes damage to the cilia in the tracheobronchial, and also smoking causes vasoconstriction. Okay, vasoconstriction leading to impaired circulation. Reflex bronchial constriction is not something that smoking causes, but it causes mucociliary clearance, damage to the ciliary. All right, you guys, I will post this and I will link the link in the description box for you guys, and I'll post this immediately so you guys can look at the Quizlet and study. Okay, I think that you guys good on the content right now, so it's all about practice questions because the HESI, it's you guys have to know the strategies when you guys do the test. You guys read the question and just focus on what is asking and know what the prioritize is, no ABC. Okay. Thank you. I hope it was helpful, and thank you for everyone to come. Thank you very much. Thank you so much.